When I first went to medical school, I thought I was going to be a family practice doctor. And so for the first probably 2 or 3 years, that was my goal, was to be your family doc. And somewhere along the line, I kind of fell in love with surgery, and urology came about because it offered the best of both worlds. You can do a lot in the office, where you treat patients in the office, like you can get to know them for a long period of time. But at the same time, you do some of the surgical procedures, and you have the instant gratification of helping somebody. All men know what the exam involves, and so I don't think anybody ever really looks forward to seeing us. Fortunately, I think things are much different than what your father or grandfather had 20 or 30 years ago. Even for just urinary symptoms where you have prostate problems, we can treat many things either with medicines or in the office. 20 years ago, if you complain enough about urinary symptoms, you got a TURP or a roto-rooter, which was being in the hospital with a catheter and irrigation and all these things for a few days. Nobody likes to have that surgery. Nowadays we can oftentimes treat 80% of our men without surgery. Everything is advancing, and that's why you have to have people who have an interest and have some interest in learning the depth of knowledge within urology. You can be a very good generalist and do a lot of things reasonably well, but if you're going to do a very, very good job, you have to do something over and over again and really focus on that particular procedure. We have within our group multiple urologists who have either subspecialty training or fellowship training, and they do a high volume of that particular problem or that particular area of urology. So I think we do a great job. I mean, we have here, I think we have almost the same as a university-based practice, but without the university setting, without residents doing a lot of the work, we have people who do almost every phase of urology. I did a urology residency, I did a fellowship, and I came here thinking, I know as much as there is to know about urology, and I spent the first probably 3 or 4 years learning. I learned new treatments, new surgeries, and it's an innovative group in that they are not afraid to learn the newest things that are out there and become experts at it as soon as anybody else in the community. I think our surgeons here have more experience with the Da Vinci surgery than probably the 3 universities' urology residency programs in Florida. By far. And that's because of the personal drive within the group to say, we want to be the best at what we do, and we want to give the best service to our patients. It's true, and I think a lot of it depends on who the patient comes in contact with. I know that even nowadays there are some men who sort of suffer in silence with having incontinence, and the embarrassment of having to wear dark pants because they go out and they wear light pants, people see they've wet themselves. Not being able to go out and do things that they want to do because of the incontinence. For me, that's probably my favorite thing to treat, because you take somebody who is miserable and you really improve their quality of life significantly. And even patients who see other urologists and the surgery is not a straightforward surgery, and a lot of urologists don't like to do it. And if you see those urologists, they may say, look, you don't really need to have anything done, or those things don't work that well. For somebody who does it over and over again, you kind of figure out how to do it well and get the good outcomes, and then those patients benefit. And so, even in our practice, that's the advantage. If one of my partners has done surgery and somebody is having some issues, they'll come and they'll talk to me, and I'll go through it and give them the pros and cons. We even do seminars where they can come, and we have patients who have had it done before, but we'll go through it step by step so they have a full understanding of what it is that they're signing up for, and then they can make the decision if they want to go forward with the procedures.